In the course of our consultations with patients, one of the most commonly asked questions is this going to hurt? And how much is it going to hurt? And what are you going to do to prevent pain? Different parts of the body have different responses to the surgery and different pain levels. For example, in the face, when we perform a facelift or eyelid surgery, there's really not a lot of pain afterwards. Most of the feelings the patient have is more of swelling or tightness, but not necessarily pain. With that said, however, we generally provide them with a narcotic type of pain reliever for the first 2 or 3 days and then transition them into something less potent afterwards, and usually that works fine. As we look at the upper torso and the breast area, usually a breast reduction where we're operating on skin and breast tissue and fat, usually it doesn't hurt too bad. There's not a lot of pain fibers in those parts of the body, and so once again, it's not a particularly painful operation, but we do manage it with the narcotics on the front end for the first 2 or 3 days and then transition to something non-narcotic as soon as we can. A breast augmentation is a little different. In a breast augmentation, we normally put that implant underneath the muscle. When we stretch out that muscle, there is more discomfort than there would be if we weren't manipulating the muscle. And so we give these patients Flexerol, which is a muscle relaxant that helps a great deal in the postoperative pain management in the breast augmentation patient. Once again, usually narcotics are given for the first 2 or 3 days, transitioning them to something less potent and non-narcotic as soon as we possibly can. The tummy area, once again, is skin and fat, not normally rich in pain fibers, and so we don't see a lot of pain, but we have a sensation more of tightness because we've tightened up that abdominal wall. But with that said, however, we do provide the narcotics for the first couple of days and then once again transition to a non-narcotic as soon as we can. Liposuction is usually, once again, not terribly painful, but when we do hear patients complain about pain, most commonly it's in the back on either side of the spinal cord area. We haven't injured the spinal cord, but that area of fat for some reason has more pain fibers, and usually that's the last place for patients to have pain. Once again, we treat those with postoperative narcotics for the first 2 or 3 days and try to transition to something non-narcotic as soon as possible. One thing to remember though is if you are having pain and you want more narcotics, we can't prescribe those over the phone anymore. There was a time 6 months ago when we could, but now we can't. So it's very important to think about that coming into, say, a weekend when the office is closed and we can't write that prescription out, and make sure that we have a good discussion with you regarding your pain management before the weekend comes. With that said, however, we always have a surgeon on call 24 hours, 7 days a week to help you with your problems.